Okay, in this video, I'm going to give you a protocol of exercises and kind of a progression of exercises you can do for osteoporosis that involve jumping. Okay, so this is usually, we find with a lot of our patients, a little bit of surprising. And we're talking about women with osteopenia, osteoporosis. They're concerned about their bone health. And they know that weightlifting is usually good for it, but what they're surprised to hear is that jumping is good for bone health. In fact, it's the best thing for your bone health. There's been several studies, probably in the last 10, 15 years that have shown this. Now, first off, I do need to say that, and this is maybe what some of you are thinking, that like, if our bones are not the healthiest, should we be jumping? And that is a concern. So this is something where you need to talk to your doctor first. I'm sure there's a certain bone density score that would say like, okay, it's okay to jump, and one that would say it's not. But the thing I'm gonna show you first doesn't even involve much jumping at all. So, but just to be on the safe side, I would talk to your doctor about that. If they know anything about bone health, then they are going to know that doing some impact, some jumping is the best thing for your bones. And for the majority of people, unless you have really severe osteoporosis, then jumping has shown to be healthy. So for whatever reason, the studies show that to get your bone to grow more bone, that it's the actual impact, right? The actual impact that causes that proliferation. And bone is like this in general in that it responds to input. So there's something called Wolff's Law. You can look it up if you want. And it basically says bone grows along lines of stress. And there's several examples of this in the body. And basically anywhere where there's like a little bit of bone coming out, poking out, probably the easiest one is this bump right here on the tibia. And if there's some pressure pulling or pushing on the bone, or in the case of jumping, impacting the bone will grow to respond to that. In the case of this, the tibial tubercle, the bone is growing out to meet the tendon that is pulling on it during a growth spurt, okay? And so that's probably the easiest example that most people have. So most women are looking for ways to increase their bone health. And jumping is something that's free and easy to do. So here's a progression of how you can start with jumping. So the first thing is you don't even leave the ground, okay? At least not your whole foot. And so the first way I'd want you to do this, and this sort of progression I actually got from a woman named Stacy Sims. She's someone who's well-versed in exercise science, and I'll link to an article, and she's the one that gives this little progression. And I think I'll add a little bit to it. But anyway, so the first thing that you want to do is actually to just squat down, meaning like you need to be able to squat down, get your knees, get your hips beneath your knees, okay? Or as close to it as you can. If you can't go all the way down, that's okay. It's better than nothing. And you're gonna go down, and then I want you just to come up on your toes, right? So from the side, and then drop down into it. So it would look like this. You're just gonna go down, get your heels up, and then go back down. Go down, get your heels up, then go back down. Just like that, okay? I'm not leaving the ground. I'm just heels coming off and then back down. Heels coming off, then back down, okay? That's the first step. You may want to do 6 of them, 3 to 4 rounds, okay? From there, the next progression would be to come off of a box and jump down basically, or step down. You can use, this is 12 inches, you can use something smaller to start. And what this would look like is you basically step off like that, okay? And again, go down into that squat, making sure your knees don't come together, they're kind of pushing out. So just like that. I'll show you one more time. Just down like that, okay? So again, if this is too easy, the first one that we did, try this one and see if you can do that. Again, 6 reps, 3 to 4 rounds. The next step would be to actually jump and land. So that would be like the first one, except you're actually leaving the ground. So it would just be down, up, and then come back down. Up, come back down. And trying to, again, get into that deep squat. It's that impact and then your body absorbing it that really counts. So that would be the third round, or the third progression. Again, 6 reps, 3 to 4 rounds. And the next one would be to actually do a box jump. So on a 12-inch box, what you're gonna do is basically, again, go into that starting position, butt low, jump up, and then land in a squat. All right, let's do that again. Get down, jump up, land in a squat. When we're instructing people here at Mission Move, we tell them to try to land like a cat or land like a ninja, meaning it should be really quiet, shouldn't be like loud like that where you're landing stiff-legged. Okay, so jump up, land in a squat. Now, I'm sure some of you are thinking, there's no way I can bend my knees and hips that much, right? Maybe you do have prior injury. Maybe there's something going on there, you have a lot of inflammation. So a couple ways that you can do this or get around this, and I've had people start with this before, is you could use a foam roll, you could hold on to a kitchen counter or something, and I want you just to put most of your body weight on this. Most of the lifting is going to come from your feet, and just jump side to side like this. Side to side, just jumping back and forth. This I would go up to maybe 20 or 30 reps, and just get that little bit of landing if going down and coming up is too hard, okay? Another way you could do this is jump rope, right? If you jump rope, you don't have to bend your knees and hips too much. It's just coming from your ankles, but you're still getting off the ground. And then the last one I would say is even like a little mini trampoline. Some people have that. And that again, the landing's a little bit softer, but you're still getting some impact, and it's better than nothing. So for all of these, doing at least, you want to at least jump 25 times in a session, right? So that's why I'm saying 3 to 4 rounds of 6 jumps. And then I would do it at least 3 times a week. And again, this is just really important for women who have osteoporosis or osteopenia. Give this a try. And then, you know, I would give it maybe 6 months to a year. And that's about how long you're getting your bone density scores checked, and just see if it makes a difference. But jumping's really good for you in general, but give this one a try and see if it doesn't help with increasing your bone density. Please like and subscribe our video, and if you have any questions, please comment below.